So my father had experienced a devastating stroke. This is about 11 years ago now, in 2007, and I lived in Sydney at the time. He was in Perth, and as soon as I could I went to Perth to be at the hospital, and recall very vividly standing in the corridor of the hospital ward with my mother, with the doctor explaining to us that my father would not survive the weekend, and that, you know, we should consider a not for resuscitation order. And being a healthcare practitioner by background and understanding the severity of the stroke, I was very keen that we did have a not for resuscitation order. But what I didn't understand at the time was that we should have talked about other options for care. So I really assumed at that point in time my father would not last the weekend, and hence didn't have further conversations about how to limit the extent to which they provided care and treatment to him during that period. And that was unfortunate because he did in fact survive, but the quality of life with which he survived was really negligible. My father didn't have an advance care directive, and indeed there was never such a conversation in our household. Other than that, my father had always made it very clear that he would not under any circumstances wish to see himself incapacitated and living the sort of life that he ultimately did live for 8 years. So having the conversation and the advance care directive done earlier would have reduced an enormous amount of stress for the family. It would have provided, I think, for a much more dignified death for my father, and would have ensured that he got the care and treatment that he wanted.